Hi, I'm Kathy.
And I'm Jimmie, Kathy's husband, and we're the owners of Safe and Steady Nurse Registry. Safe and Steady is a private home care company based here in Delray Beach, Florida, and we've been servicing all of Palm Beach County for the last 10 years. Safe and Steady was born out of necessity. On a Sunday night at about 11:30, the dreaded phone call came that my father had fallen and he was on his way to the hospital. By the time Kathy and I got down here, my dad had already been operated on for a broken hip. From that point on, we both noticed that my mother's world was completely changed and that she was going to need care in the house for as long as my father was around. The services that we provide are crucial, but it's a service that nobody really wants, but when you need it, there's nothing more important. So just like a lot of our clients, when you get that phone call, whether it's 10 o'clock at night or 10 o'clock in the morning, that your loved one is down and out and they need help and you have no idea where to go or what to do, that's our niche. That's where we fit in. We just don't supply an aid. We supply a way of making sure that your loved ones are home and safe and comfortable. And trust me, over time, we become an intricate part of their families. I've seen on more than one occasion a client calling Kathy asking her for an exterminator or an electrician. And we pride ourselves on that. We're not a giant agency. We know all of our clients personally. We've been in all of our clients' homes.
We do go the extra mile to make sure that we are providing the proper caregiver for the client, matching the best caregiver with that particular case. Having the client meet the caregiver before they actually start work so that they feel that they have a little bit of input in who is going to be working with them in their own home.
It can be a very difficult transition. You know, your mom or your dad or both of your parents have been living alone or together for the last God knows how many years, and now all of a sudden there's a stranger living in their home. It's not an easy transaction a lot of times, and there's plenty of occasions where we have to coddle our clients and the family.
However, once you get the right person, you realize how much easier it is on you.
By far the biggest issue in this industry is caregivers. It's the company that puts the time and effort to interview hundreds of them to hire a few. But the ones that you hire, as long as they have a big heart, they do fine. I've had clients that have been with us for years who say, you know what, this girl saved my wife's life. And you know what, at first I complained about her language, or I complained about the non-sophistication, or I complained about her sometimes being late. But when my wife needs to get dressed and cleaned up in the morning and this caregiver's by her side, I don't worry about a thing. And that you can't put a price tag on, because that's the hardest part. Having someone to take care of somebody is one thing, but having someone that cares, that's kind of tough. But that's what we do. That's all we do. We are a nurse registry. We are not a home care agency. We do not deal with any other disciplines, no physical therapy, occupational therapy, speech therapy. We only deal with putting caregivers in someone's home or at a facility or at the hospital, whether it be 5 hours a day or 24 hours a day.
We have certified nursing assistants, home health aides, registered nurses, LPNs. That is the services we provide, whether it be helping with medication reminders, light housekeeping, errands, showering, bathing. If other services beyond that scope are required, we are happy to refer to physical therapists and speech therapists.
The main difference to understand, nurse registry, home health agency. Nurse registries are pretty much only indigenous here in South Florida because there's such a need for in-home care. But that's all we do. We don't deal with any physical therapies or speech therapies. We only work in one thing, which is putting caregivers in people's homes. Now the range of caregivers, as Kathy says, goes from a companion all the way up to a registered nurse and everything in between. The most common caregivers used are home health aides and certified nursing assistants. And they're educated in multiple disciplines, from transferring and bathing to medication management and other important things.
Providing meals,
Well, we'll provide, yeah.
Transportation.
The key one there, another big one, is light housekeeping, and I say it like that because it is light housekeeping. The bottom line is, if my client is in the men's room in the morning and he's getting washed up and dressed and bathed, before that caregiver leaves, he or she has to make sure that that room is clean, neat, safe, and sanitary. We always tell our caregivers, you're taking care of 1 or 2 elderly people. There's not that much to do. These houses are always spotless every time we go into them anyway. So the services that they provide will grow in time. When a caregiver can get into a house with nice people, that brings a lot of value to the caregiver. It really does. They know that they're going to go be with people today that really appreciate them being there, and it means a lot to them.
All of our caregivers are screened. They are credentialed. They have fingerprinting done. They have.
Go farther than that, though. You call references.
No, I'm saying they have CPR. They have all their continuing education. Everything is kept up to date.
When their documents expire, we notify them.
They need a current health physical.
Yeah, that's the big one.
If they're out sick, they have to get clearance before they can come back on a job, because we don't want our clients to get sick or catch anything that the caregiver might have had.
There's a lot of small rules that need to be adhered to. We do. I can't say that for every other agency out there, but I wouldn't feel very happy if I sent out a caregiver who we knew was sick to a client, and God forbid that client gets sick from that. It's little things like that, the little things that make the big difference.
Now, if a caregiver is out and is sick, we make it our business to try to get someone as similar to that caregiver to fill in.
Plus you brief them. Like Cathi will never just say, all right, you're filling in here and just go. She'll brief them, bring them up to speed on the client, the significant other, if they have doctor's appointments, their do's and don'ts. We try to make it a soft landing as best as we can. But as with our clients, as with us too, everybody's looking for stability. They want to know that the same girl who's been coming for the last few months, who gets here every day at 8 o'clock and leaves at 8 o'clock at night, will be the same. And that's the important thing, is building the stability. Because let's be honest, nobody wants a caregiver. But when you need it, there's nothing more important.
As we say, it's not a luxury, it's a necessity.
I met a new client a few weeks ago, an elderly gentleman in his 90s, and I went to see him in the rehab on a Tuesday afternoon. And his son was there, and he was there was a nurse in the room, but I was talking to this gentleman. He knew the last 4 digits of his social, his height, his weight, his meds. He was coherent, and he was recovering from a car accident. Daughter comes to town 3 days later, gets in touch with Cathi, and the daughter proceeds to tell Cathi that they had to almost threaten to bring the police to get their dad back into a hospital. Evidently, he had a setback previous days, and no one at the facility did anything. And that's our point, that when you're at home and you have private care at home, it's the safest place to be. It's the most comfortable place to be, but it's definitely the safest place to be. And most of our clients' children do not live here in Florida. So when they get the panic phone call from their parents, we're usually the next phone call after that. What's going on? What do we need to do? How do we fix it? And that's where Cathi jumps in, and George and Cindy and everyone else, and it's all hands on deck here, I will tell you that. My title might say CEO, but trust me, I'm calling aides and tracking down this as much as anyone else. When we need to fill a case, Cathi fills the case. I just do the heavy lifting. But it is all hands on deck here.
We had a client that was in the hospital, and the nurse came in and took her temperature, and the caregiver was there as well as myself, and we had asked, does she have any fever? And they had said, no, she's, fine, 98.7. The nurse leaves. 10 minutes later, someone from infectious control walks in to give her a shot. I had asked, what is the shot for? She said, well, she's running a fever. We need to give her a shot. I said, well, the nurse was just in here and she did not have fever. So I refused the shot for the client. Turns out it was actually for the patient that was in the bed next to her. They were giving her all the incorrect medication. It was actually her husband's medication that they had. I called her doctor and had her discharged because unfortunately her doctor did not have privileges to that particular hospital, which happens quite often here. We had her discharged with the caregiver to go home with the client. And thankfully, we did that, or who knows what would have happened.
You know, amongst all the other wonderful things that you do, it is important, though, because when your loved one is in the hospital and you're not here, if you don't have some sort of an advocate, you're done before you start. Mm-hmm. Now, Cathi worked when we lived up in New York in Mount Sinai Hospital for years as a nutritionist, and she worked with the elderly, and I can show you a pile of letters from clients can't thanking us enough for running interference with their doctor and with the hospital. It can be very, man, it can be very daunting because your biggest concern is my mom or my dad may not be doing too well, but now I got to deal with trying to figure out how to navigate through a hospital. I'm not even in the state. Hopefully you never need that, but when you do, there's nothing more crucial because mistakes happen. Not on our watch, or we try not to, but they will happen. And you're dealing with elderly people. You know, you speak to the average guy in his 30s and 40s, and you've mentioned to him falling down, and he's like, yeah, I fall down. These people fall down, they shatter. So that's the biggest prevention, is falling. That's the biggest mantra that I use, is to tell these girls that this client cannot fall. Because once they fall, it's not the fall that really does them in. It's just the beginning of a slippery slope of everything from infections to small seizures to just having negative reactions to painkillers and other meds. So it's preventive. You know, you can wear the bell around your neck, you know, I've fallen, but by then it's too late. With us, it's all preventive. Keeping someone home, right, safe, comfortable, meals prepared for them, laundry done, taking them to the doctor, taking them to the grocery store. I guess we have clients who take their girls and guy caregiver to a movie, to theater. They become part of the family. We have been doing this long enough to know what works and what doesn't work. And we've run into most obstacles, whether it's the client themselves or a family member or a lawyer or the doctor. But the bottom line is, we do what we do and we do it well. It's all we do. We have a good core of caregivers in our registry that we rely on, whether it's for full-time or fill-in. And the bottom line is, we will never just go down a list and say next and just send somebody that is not qualified.
We are here 24/7 to answer any kind of questions that you may have, a family member may have. Even if you're not ready for home care at the moment, we are happy to assist you in any way we can at any point in the journey of looking for home care.
You know, some of our clients are wonderful people, and some of them have some cognitive issues. They do. I see how many times your phone rings, and it's the same client with the same question, but an hour and a half later. What are you going to do? You answer the question and say, thank you, Mrs. and I'll speak to you soon, and that's just part of it. These people love to know, your client, our clients love to know that when they call, one of us is picking up the phone. Because, man, when you need to get in touch with someone and you're dealing with an answering service or a secretary, and my father or my mother is now in dire straits and I can't get a straight answer, we all know how frustrating that is.
And no question is too little. We always say the little things. If you don't ask the question or you don't let us know about a need, if it's not working out, sometimes we can intervene and we can correct it early on. The littlest things turn into big things if we don't tackle it right away. So, you know, for us, you know, the communication is key.
Micromanage. This is in a unique industry. This is the only industry that if you do not take it personally, you know, the famous saying, it's not business, it's personal. If you do not take, you're in the wrong line of work. I came into this industry as a newbie. Cathi had been in it for years. But I will tell you, if you care, which I know we all do, I didn't know I cared as much as I actually do, but I do. And if you use caregivers that have big hearts, that just care, you'll do fine. Your loved ones will be happy. Nobody gets in this industry as a caregiver to become rich. It's not that kind of an industry. But if you care, and it's what you're good at, you'll have good work. You'll have good clients. And you know, these caregivers want to keep their clients alive and healthy because it's a nice job. It makes our life easier. Most importantly, it makes our clients' life easier. And their children and everything else that's involved.
Thank you for your time. We hope you found this video helpful. We are always available. If you have any questions, please do not hesitate to call us.